Well, hello. My name is Spencer Bell. I'm the policy analyst for the National Coalition for Homeless Veterans. The reason for this video today and the reason why we're reaching out to you is because we're giving you a brief update on the CARES Act and what is being dubbed CARES 2, the legislation that is being cobbled together to address the response to the COVID-19 pandemic. And on that, I'll give you a bit of an update on where everything stands. I mean, while CARES Act was a step in the right direction, there's still a lot more that needs to be done to staunch the extra pandemic-related increases to veteran homelessness. And right now, Congress is currently meeting to actually pass the CARES 2 Act. And we need your support to get full funding for the homeless veterans programs. Currently, under the original CARES Act, the VA was given $14.4 billion to spread across veterans programs in general. We were doing our advocacy to get those monies, portion of it, portion to homeless veterans programs, and we were able to get about $300 million to support these homeless veterans programs, especially about $202 million for the supportive services for veterans families, SSVF, about $88 million for rate hikes on GPD, which is grant and per diem, and about $10 million for healthcare for homeless veterans, or HCHV, to provide expanded isolation and access to care for pools of individuals that have expanded eligibility in these other homeless veterans programs. So that being said, when we were originally putting together how much the expansions to these programs would cost, we were doing this for the CARES Act. So it was for the first few months what was needed immediately to provide these services for homeless veterans. And now that we are seeing that these issues are not going to be going away immediately, secondary peaks in the homeless veteran population, especially in areas that have already reached their peaks, where we see this as an issue that needs to be addressed as from a public health standpoint. That being said, we have done our calculations and estimates and found out that it will cost about, at a minimum, about $1.34 billion to fund these programs all the way through 2021. And we have an agreement across Republicans and Democrats, both in the House and in the Senate, on the wording, the verbiage that is going into this legislation on the flexibilities, waivers, and expanded capabilities that are being given to the VA, and especially these homeless veterans programs. And it makes absolutely no sense to give them these expanded flexibilities in CARES 2 if we don't give them the money to pull it off. So right now we are asking our supporters, our members, anybody who supports homeless veterans and these programs to please contact your representatives, your senators, and let them know that you support full funding as their constituent for homeless veteran programs. And that full funding comes to a tune of $1.34 billion on the low side to provide all the services minimally that the VA is trying to provide. To do this is not a very hard thing. This will take 5 minutes out of your day. We ask you, one, forward this information, this video, all the resources that you find to all the contacts that you know care enough about this to actually provide some advocacy here. After you've forwarded that information, one, go to congress.gov. Find out who your senator is, your senators, your representative, and find their contact information. Should take you a grand total of 60 seconds. Number two, go to nchv.org. At nchv.org, we have resources, email templates, social media hashtags, and resources that you can use for your postings. It's a great resource. Go there and get all the information you need to make your call or your email. Number three, make the call or send the email. The congressmen and senators receive these on a daily basis. The more they receive, the higher tier it goes to, and especially from constituents. If they get more than 10, it goes in a tier. If they get more than 100, it goes in a different tier for their responses. So what we ask is that you make this contact, get this request out to as many individuals in your sphere's influence as possible, because this legislation will move soon. We ask that you abide by the CDC guidelines, that you respect social distancing, and that you not approach your representatives. You do not send any physical letters, as those will get there probably after this legislation is passed. So please call, email, and you can always find more information at nchv.org. You can reach any of us at any time. Feel free to email us with any questions. Again, let's continue to work for veterans and let Congress know that veterans deserve homes, not COVID. Stay safe, everyone.